Hello and welcome to Case of the Day. I'm Dr. Croley, and usually on these days we talk about an interesting patient or an interesting case, but today we're going to be discussing the future of healthcare. A few weeks back I did a short presentation on the future of healthcare and got such a huge response that people wanted more information, so we're going to go back over and cover some more things about what's happening to healthcare in the United States today. So this goes back to the stimulus bill. So in the stimulus bill, there were provisions in there that stated that all hospitals and doctors must begin using electronic medical records. And the government, trying to be a nice, entity, decided that they would, okay, we'll give you $19 billion for the cost of implementing these electronic medical records into the hospitals and doctor practices. And each doctor can receive $44,000 spread out over five years to pay or help pay for the electronic medical record. It turns out that it's going to cost a lot more than $44,000 for doctors to do this, and so it really is going to be a burden on these practices to implement one electronic medical records program, pay for it, the cost of maintaining it, and having an IT person around to take care of the problems that happen when you're running a computer system. And the big hook is, and the big problem with all this and what's going to happen to healthcare is that in order for the doctors to get the $44,000, they must use this electronic medical record in a meaningful way. So now the government has decided to describe what meaningful use of electronic medical record is. I've been using electronic medical records since 1998, and I did just fine without them telling me how to use it or what meaningful use of electronic medical record is. So basically, what do they mean by that? Well, it's really smoke and mirrors. That's not really what they care about. They really care about the rules and regulations that go into meaningful use is they want to control your health care. That's what the bottom line is. So in this bill, they set up a committee called the HIT Policy Committee. This committee decides how doctors are going to practice medicine. So it's divided up in 3 stages of electronic medical records. And if doctors don't follow these stages, they don't get the $44,000. And eventually, if they don't follow these things, starting in 2015 or 16, they will be fined by the government for not doing so. And so eventually we are going to be required, no matter whether we want to or not, to report the things that they request in this meaningful use to the government. So the committee reports, this HIT committee reports to nobody. They don't report to Congress, they don't report to you, no one, you don't know that this committee probably even exists. Probably most doctors don't even know this committee exists. But they're sitting around doing and writing rules and regulations that doctors follow. Stage 1's already been implemented. Stage 2 is just now getting ready to be implemented. And basically these things you are required, or I am required to report to the government how much you weigh, how much you smoke, how much you drink, what your body mass index is, and all these kind of things. And it keeps getting, stage 2's even more reporting. Stage 3 is where the problem comes in. So in stage 3, the electronic medical record is supposed to print out a treatment protocol for whatever the diagnosis code is that the doctor puts into the record. So they've been now collecting all this data over time, and now they think they can become a doctor. And so the government's going to then collect the data, use that, so then when it comes around to time for you to go in to see your doctor, they now want to be in that room with the doctor. They want to be in the exam room with you, so that way when the doctor puts in the diagnosis code, out pops on the medical record on the computer a treatment protocol, whether the doctor and you agree with it or not. That's what's going to be followed. So the government's going to control health care and what care you get with no vote by you, no knowledge that you know this is going on, no vote by Congress, nothing. And so that's the reason why this is so important. The future of healthcare is going down the tubes, and the requirements that our doctors are having to follow are so draconian, it's getting out of hand. We can't practice medicine anymore. We're too busy making sure we cross the T's and dot the I's of what the government says we have to do. And so you're going to see an exodus of doctors leaving practice or stop seeing Medicare patients because the government is just too involved and too overregulating what doctors do. It's gotten so bad, actually, just recently on ABC, the government's jumped into making hospitals and doctors do all this with electronic medical records without really thoroughly thinking through the process, that now, according to ABC, 25 million records, your records, 25 million records of the American public are now out for sale. That is, people can buy your medical record for a price, and the biggest, I guess the highest price according to the ABC report was, it's $12 for a medical record of someone who has diabetes. So now, because of not protecting your medical record correctly and setting all this up prior to implementing all this stuff, your medical record's at risk because of electronic medical records. It's difficult in the old days with paper. You could only steal so many stacks of paper, but you can still thumb drive in a computer and steal a lot of medical records. So that's where we're going with healthcare, and so that's the reason why I'm imploring you to have your friends, your neighbors, your family watch this video. Become involved in what's happening to your healthcare. We're now in an election. This is the time you need to be calling your senator, your congresspeople, or people you may want to support who are running for the first time for these positions. Call them. Ask them what are they going to do about this HIT committee. It needs to be vanished. It needs to be totally and all the rules and regulations they've written need to be abolished. The only thing that needs to stay in place are the rules, are standards for protecting your medical record and making sure these records communicate from one to another so your record is accessible no matter where you go to. Other than that, the government needs to stay out of the exam room and stay out of your health care because they don't belong there. It's your health care, not theirs. So please contact them, make other people know, informed about this, and because you're going to wake up one day and you're going to go into the doctor's office and you're going to say, Dr. Wilson, my knee is really killing me. I am really having trouble walking, and I need something done about this. And the doctor examines your knee and says, you need a total knee replacement. But electronic medical record prints out, gosh, you don't get that because you haven't been a good citizen. You smoked too much, you drank too much, you did this too much, you did that too much. And so therefore, you don't get the total knee. You get a wheelchair or a walker or crutches or whatever they decide to give you. That's what's going to happen to your health care. So again, please call your senator, your congressperson, and you Tea Party people who are anti-government being in anything. You should take this up as a huge banner for your cause because the government's coming into the exam room. So if you have any questions about this or other topics we discuss on Case of the Day, you can always contact us through the website. Be happy to try to answer any questions you have. And if not, may God bless you with healthy eyes and great vision.